Smith.
Hi.
I'm Katie, and I'm going to be your nurse today. I just wanted to discuss your new medication, fludrocortisone.
Okay, that sounds good. I'm kind of confused about it.
Well, that's why we always make sure to educate our patients on any new medications. So this new medication is prescribed for people with adrenocortical insufficiency. And what that means is that your body is not producing the right amounts of certain hormones. Your adrenal glands, which are located right above your kidneys, are responsible for producing cortisol and aldosterone. And in your case, your glands aren't producing enough of these hormones.
So what does that mean?
So it means that cortisol and aldosterone, which are very important to your health, you're going to need to take this medication as prescribed in order to get these hormones back on track.
So what do the hormones control in my body?
Well, cortisol is very important because it helps your body respond to stress, and it also helps maintain blood pressure and your cardiovascular function. It helps balance the effects of insulin in breaking down sugar for energy, and it also helps regulate the metabolism of proteins, carbs, and fats. And aldosterone is the other hormone produced by your adrenal glands, and that hormone helps maintain blood pressure and water and salt balance in your body. So when that hormone level gets too low, the kidneys can no longer regulate the water and salt balance, which causes your blood volume and blood pressure to drop.
Oh, that might be why I get so dizzy when I stand up.
Yes, exactly. So this is a very common symptom of adrenocortical insufficiency. So you will be taking fludrocortisone once a day to replace the aldosterone that your body is missing. You will most likely also be put on a synthetic glucocorticoid to replace your cortisol. And I have some handouts for you so that you can review this information at home.
Thank you.
You're welcome.
Hi, Mrs. Smith. I'm Jenna. I'm another one of the nurses on the unit. I understand that Katie came and spoke with you earlier about your new medication, fludrocortisone. Is that right?
Yes. That is correct. She gave me some information pertaining to my new diagnosis and how the medication works with my disease, and it was very helpful. All of this information can get really confusing though.
That's great. I'm glad that you got some clarity from that. I understand, and we try to make it as easy as possible for you to understand so it's not overly stressful for you. So I wanted to come and talk to you specifically about some of the side effects that you may experience with the medication. Does that sound okay?
I would like to know how the medication is going to affect me.
Sure. So I'm going to go through the side effects with you, and if you have any questions as we're going along, just please feel free to stop me. So some of the things that you may experience while taking the fludrocortisone include muscle weakness, thin skin, insomnia, stomach upset, headache, dizziness, weight gain, mood changes, increased appetite, increased sweating, acne, and potentially osteoporosis.
Wow, that's a lot. Those sound pretty serious. Weight gain, osteoporosis, and insomnia, those all sound like pretty significant side effects.
I know, and because this medication is a steroid, it has more of these effects on your body because of the way it interacts within your naturally occurring steroids within your body. So these do sound serious, but there are ways that we can control it, such as finding like a diet regimen that works for you when you experience an increased appetite, doing regular bone scans to check your bone density, and recommending some over-the-counter or herbal sleep aids to try to rid of any insomnia you may experience.
Okay, so as long as there's ways to control the side effects.
Yeah. Also, the most important side effect of this medication is something called immunosuppression. Have you ever heard of this before?
Maybe, but I'm not very familiar with it.
Well, basically it means that the medication will lower your body's immune system, making it easier for you to get sick either with something minor like a cold or a stomach bug or something more dangerous like an infection.
Okay, so how can I prevent that from happening?
Well, something as simple as following a strict hand hygiene regimen will greatly decrease your risk of illness and infection. So make sure you're definitely on top of your hand washing. In addition, avoiding large crowds whenever possible, like at the mall or at the airport, is suggested in order to decrease the likelihood of catching something that you encounter.
Oh no, the airport? I have a trip to Europe planned for next month. Do I need to cancel it?
No, just making sure that you're washing your hands regularly, especially in the airport, will be very important. Also, wearing a protective mask over your nose and your mouth, both in the airport and on the airplane, is extremely important since most of the things that make us sick we are encountered through the air we breathe and the things that we touch.
Okay, that sounds doable. Is there anything else I should know about?
So, going along with the infection control theme here, we want to call your provider at any first signs or symptoms of infection, including pain, swelling, fever, or any symptoms that become noticeable to you. This way we can catch something soon if you indeed do have an infection. You also don't want to stop taking the medication suddenly. This is really, really important because if you stop taking it suddenly, you can go into what's called an adrenal crisis, which can make you really sick. You should only stop taking the medication when the provider has told you to stop taking it and when they have given you what's called a tapering schedule, meaning you will decrease your daily dose until you are no longer taking the medication. This way your body will adjust gradually rather than all at once. Does that make sense? Can you kind of tell me what I just told you in your own words?
Yeah, so I'll call my provider at the first signs when I notice that I don't feel well or have any noticeable symptoms that you mentioned, and I also will not stop taking the medication without my provider's orders, and will make sure I follow the taper schedule according to what the provider tells me so that I don't go into an adrenal crisis.
Great. It sounds like you really understand, which is really good because it's very important. I just have a few more things to go over with you. I know this is a lot of information. It's also important for you to get regular blood work done while you're taking the fludrocortisone because if there's too much or not enough steroid in your body, it can become dangerous. By getting regular blood tests, we can determine if the dose you're taking is the right dose for you. Make sure you communicate with your provider about any current medications that you're taking, prescription, over-the-counter herbals, in order to avoid any dangerous interactions. And lastly, it's generally advised that patients on fludrocortisone follow a low sodium, potassium rich, high protein diet because of the way the medication acts on the body.
Oh no, I'm not very good at reading labels for food. How can I make sure that I'm eating the right things?
Good question. As I mentioned before, we can definitely schedule a consult for you with a dietitian or a nutritionist so that you can get some more info about what foods are good and which ones you should avoid.
Okay, that sounds great. I think I will take you up on that.
That's good. I think that does it. Tell me one more time what I just told you in your own words.
I will go and get blood work done in intervals made by my provider in order to make sure that I'm getting the right dose of my medication, and I will go and see a nutritionist in order to make sure I get all the nutrients I need to stay healthy while I'm on this med.
Great. Do you have any other questions?
I don't think so.
Okay. You can always call the office if you do come up with any more questions.
Okay, so in my part one, I used the teaching method of giving the patient some handouts so that they could go home and review the information on their own.
And in my part two, I did a lot of teach back, making sure that the patient understood all of the information that was gone over and they say it in their own words so that I know that they know what we're talking about.
And that's it.
And that's it.